We're all in this together. What I'm teaching in my EMT classroom is likely the same as what you're teaching in your EMT classroom. If we're not seeing successful results, which by the way, we need, right? We need more healthcare providers, nurses, doctors, EMTs, paramedics, across the board, we need more of them. That means we need continued success in all of our classrooms. If there's something we can do together to work on, to look at, to say, gosh, how are you testing? How are you marketing? How are you administering? How are you educating? What we can do together makes us all stronger.
You're listening to Cold Press Conversations with Dr. Jewel White Williams, a lover of numbers, lists, and a good glass of cold pressed juice, who is sharing episodes each week to help you explore the back end of healthcare and health sciences, where a lot of that grit is done. We'll dive into topics covering research, education, and clinical practices, as well as guest shows with other leaders in the field. Pull up a seat and let's dive into these amazing and game-changing conversations. Hello and welcome. My name is Dr. Jewel White Williams, and I am here tonight for Cold Press Conversations. It's an insight into health science instruction, research, and the clinical perspective. It is brought to you by Black Tie Legacy, and I am the host, Dr. J. White Williams. I have a doctorate in health sciences, and I focused on clinician as well as higher education. The purpose of having Cold Press Conversations is because I feel that it is time for people to understand what health science instruction is like, what health science research is like, especially the clinical perspective. As we move along with healthcare, we know that there have been significant changes that have been occurring. And that's one of the things that we need to understand. Ever since we had the pandemic, we noticed that instruction has changed. Students are having different perspectives of meeting their clients and their patients. And also within the field itself, nurses, firefighters, EMS workers, and even our allied health professionals are having to make shifts in instruction to ensure that we're meeting the needs of our students and our patients. More and more things are coming to the forefront, and what better way than to reach them with the guests that we have. Tonight, I have a special guest. His name is Michael Kaduce. Let's welcome him in. Hello, Michael.
Hello, how are you? Good evening. Welcome from Southern California.
Oh, sunny California. Okay, I'm gonna get there one day.
Anytime you want, you're welcome here. We have great seafood and it's pretty much sunny and 70 all year round.
Oh, and see, I'm a Maryland girl. You know I like my seafood.
Ooh, yeah. Well, you guys have good seafood out there too.
Yes, I love seafood. Growing up in Maryland, you have that Chesapeake Bay and you have nothing but all those wonderful crabs that come to the table.
Yeah.
Michael, I am just elated that you are just on tonight. I really am. I have to say thank you for being my first guest.
Well, I'm honored to be here, and we should tell the listeners how we met because it's our shared passion, I suppose, for education and for research and combining the two. I think it's so common for us in healthcare to talk about evidence-based practice and how we give treatment that's validated, but we do the same thing in education. You know this as a school principal and providing the tutelage to so many students. It's like there's science behind this. There's a way to do this well, and that's what I think we can all think back to our favorite educators and think like they taught me how to learn. And we should be able to bring that science and those techniques to healthcare education.
You are so right. The thing about everything that I do is, okay, let's talk about where we came from. All right. I had the pleasure of just cruising the internet, and specifically LinkedIn. And if you're not on LinkedIn, I highly recommend that you take the opportunity to join LinkedIn. And the reason why I wanted to get on LinkedIn is because I wanted to expand my knowledge base. That is an awesome area to just focus on learning more about your professionalism, how you can reach out to other people who are like-minded like you, and to also learn from others. And I have learned so much from so many people. And what happened is that there is something called ESO. It is an opportunity for us as providers. I am an EMT. And I do use the program ESO. I cannot mention the actual company I work for because this is a private setting. However, I do want to say that when we do receive a patient, we must write our EPCR, an electronic patient care report, in an ESO fashion. It has many demographics and many things that are in there, and that's where we write a report. They offered an opportunity for you to learn more about research, which is my love. I have loved research ever since I was in high school. Yes, on a typewriter. And oftentimes I have wanted to go a step further. Even though I had just completed my doctorate, I was just still eager. Yes, after I finished writing that dissertation, I was still eager to learn more about research. And that's when Michael walked into the room. And I immediately, Michael, I don't know if you remember, I was at the table and I said, I think I know you. And you said, you do look familiar. And it was because of LinkedIn.
Yep. Yep. It was 100% LinkedIn. And I was walking in at the same point you were. I was like, I love research. I know a little bit about it, but I've never actually gotten to do it. And yeah, with ESO just sets us up with a statistician and a polished researcher and a whole bunch of topics. And in essence, we got to pick our topics and what we wanted to look at.
Yes, we really did. And that's an exciting opportunity for anyone who wants to learn more about emergency medical services. There's a lot of information that can be had from there. And I just spoke to one of my paramedics who is an amazing provider, stated that his wife is going to be going to ESO soon. So this is kind of exciting.
Yeah, for those of
Yeah.
interest, it's a partnership between ESO and the UCLA Pre-Hospital Care Research Forum, PCRF. So if you're interested in signing up, you can literally just Google UCLA PCRF, and their homepage has the sign up information. And I'll be the first to admit, I'm just a paramedic who doesn't know a lot about research, and they let me come. And that's the goal. It's not for someone who's got 14 publications under their belt, though there are people there that have some publications under their belt. It's really for the up and coming researcher who wants to know a little bit more about it and learn the evidence-based process behind writing a manuscript.
It really is. And it gave me an opportunity. There's so many things about that that I really like. When you're doing your own research, your personal research, it's you who has the control of it. But as you and I know that when we are with a group, we have to keep in mind that we have a group. Group projects require participation from all persons who are in it. And then it shows the investment of who actually has the investment, who may want to just stay behind the scenes to still learn. And
Mhm.
that is one thing that I learned in this process. It's not even about dedication. It sometimes you feel like, oh my gosh, it can feel overwhelming. So I guess that's a good question. Why don't we ask, I have this question. I have several questions for you. Do you feel like research can be overwhelming at times?
Oh, absolutely. And I think back to group projects, I'm still scarred from middle school from group projects because you always know somebody ended up doing all the work and everybody else just took the credit or showed up at the last minute. I do think research can be overwhelming, and especially for a first-time research. And I remember doing my master's work, we ended our master's with like it was sort of a manuscript type paper. I didn't end up actually publishing mine, but in essence, it was a retrospective review of a whole bunch of data. And I was like, I have nowhere to start. It was in essence a semester long class. And so if you don't have that experience or any experience walking into can be really daunting, especially because I think when most people think research, they think quantitative research, so numbers and data and statistical analysis. And there's only about a million different tests you can run on data. I want to like shed some light on it. The majority of the statistical analysis we run is something that like Excel can run, and it's not super hard to explain. Odds ratios and things like that are fairly easy to calculate and you don't need a fancy stats program to do it, but it can be daunting. I encourage people like, I'm not brilliant. In fact, I'm thankful for all the academic institutions that have hired me in the past because I probably couldn't meet their entry level requirements to apply to their school. So it takes a little bit of guidance and a little bit of forward thinking. But I would say like I came in with a couple ideas to the research workshop, and I was blown away by the people's ideas that I was like, oh, that's way better than my idea. And I really actually, that sounds interesting. I'd like to do that research. I'd like to look into it. So for those budding researchers out there, don't be daunted by the process. If you have a really good idea, that's where this starts. And all of our papers have all just started with somebody asking a question like, hey, this is something we should look at. It's EMS is too new. We don't have enough research out there. So there's plenty of opportunities, but yeah, it can be daunting. Absolutely.
You know, as a health science educator, which you are, I guess my biggest thing is they shy away, educators themselves, the instructors shy away from research sometimes, not just conducting the research, but sometimes looking at it because when they start looking at the actual papers themselves, it's a process in which you have to read them.
And sometimes we don't want to know what the results are, right?
No.
that sometimes the results can scare us and be like, oh shoot, I need to fix that. But I don't know how. I think too, we should start with like educators are incredibly underpaid and overworked, right? So it's not like most healthcare educators out there are like, I have plenty of time on my hands to do something extra. So research is oftentimes extra unless you work at an academic institution where they prioritize publication. You're probably doing it because you're interested or you want to do it, or sometimes even recognition. So there's probably a lot of health educators that's the stepping stone, right? Is like you need someone to prioritize it or you have to prioritize it yourself. But then, yeah, I think there's definitely opportunities to look at the data, even in small classes, right? Like not all research has to be published. We do this all the time. We do item analysis of 3 or 4 classes to look at how they scored on an exam. We do a little bit of data analysis. Item analysis is in essence data analysis, but we didn't publish anything. We just wanted to look at it to see how it stacks up. Taking that brief item analysis and turning it into a publication is not hard. You're probably not going to publish how great your students' airway exam scores are, but that process is the starting point for research, right? The validation of an exam process or evaluating we just rolled out supraglottic airways into our skills lab, and we weren't quite sure how many of them we should set as the requirement for our EMT classroom. Like, so how many supraglottic should they insert before we're going to like sort of deem them competent? So
Mhm.
we're like, well, let's try 2. Well, they got through 2 in about 10 minutes. So then we were like, well, let's double it and try 4, right? That's the basis for research is we had an idea, we had a question, we didn't know the answer. So trial and error, we sort of figured it out along the way. Probably not something we would publish there, but that's the basis for research is to find an opportunity or a question and go from there. I will be honest, the most recent publication we had at EMS World was a faculty member of mine who's just had a really good idea about whether college education helps you pass an EMT class. And
Yeah.
it was a great question. And we were like, well, we do have that data. It was in different data systems. So we had to go find it and sort of put it together. And that's what took the most time. And then we just did some simple comparison statistics. A T-table, again, Excel runs that data pretty easily. And we wrote it up as an abstract and got that idea out there. So I think sometimes we think research is above and beyond what we're already doing. But
Mm.
oftentimes, I mean, statistical analysis, a T-table is pretty straightforward. People might do that if they have a accelerated class and a hybrid class, or if they have a traditional level class and a hybrid level class, and they want to compare completion rates or NREMT pass rates to find out if they're statistically significant. I mean, that's all just a T-table with a pretty standard 0.05 p-value. So like that's a starting point for research, and that got an abstract at EOS World. So.
Oh, that is awesome. Okay. So this brings up one thing. As an educator, I think some of the things we need to know is that what you just talked about and the things that actually occur with research is that learning from it. And you mentioned it was kind of a fun thing that you said. Sometimes we don't want to know what the actual result came out as. And yes, we may have the idea that the result is going to be into our positive, but sometimes it's not. So, how is it that we can stay up to date with the latest advancements in health science, but yet still use it, even if it's something that we may be a little iffy about? But how can we use it best within the classroom?
I think that's a great question. I think one of the easiest things to do is be a subscriber to research. So you can sign up on most research journals where they'll send you a monthly email with the abstracts that were published. Most of us probably have some access through our academic institutions or our hospitals where we can get the full version if we want, but typically the abstract should tell you what the results are. If they wrote a good abstract, it should. So you can sign up for those. I'm a subscriber for all of the healthcare journals, pre-hospital emergency care, sort of the big one, disaster and emergency medicine. There's a new one, the International Journal of Paramedicine. They post
Yes.
educational stuff. Yeah, it's not even indexed yet, but you can still sign up on their website. They're still publishing, and they'll email you when research comes out. Again, not all of it's going to be educational. There are educator journals that are out there as well. There's a whole bunch of them, and you can subscribe to those. I subscribe to a couple of them. I will say some of it's extrapolatable, some of it's not. There's plenty of publications out there that came out of COVID that looked at hybrid education, remote education. We do a lot of that in healthcare. A lot of that can extrapolate out, especially right now as we're looking at micro learning. That seems to be the buzzword that I've heard
Yes.
recently. Yeah, there's plenty coming out on micro learning, and as long as we're looking at our same population. So for me, it's adult learners. Probably not going to extrapolate what a fifth grade micro learning research has to do with adult learning, because we know there's difference in pedagogy and andragogy, but you can extrapolate a lot of that into our communities. So I think that's a starting point, is just to get those emails and skim the abstract titles and the title and the abstracts that are interesting to you. I typically don't read the whole paper unless I'm like, ooh, that's really interesting. I want to know their methods, or they have really cool results. Then I usually look at the methods to see how they got there. But I think that's the starting point for saying, okay. And I had this conversation with someone just the other day. We were talking about how we still struggle in healthcare education with some of the things that have been well proven. Things like temperature regulation in classrooms was published in the 50s. People don't learn well when it's hot and cold. Weird. But we're still having classrooms in the ambulance bay, for example, and no matter where you are in the United States right now, it's cold. That's probably not the best learning environment for your students. Same thing, sitting in front of a group of people for 4 hours and lecturing at them without breaks and activities. That's been well proven to not be the best way to educate. And yet we still have a lot of that in our classrooms. I mean, we still have that in primary and secondary education. So we're not that far behind the curve, but
That's kind of interesting because when you said that, the first thing that came to my mind was the 1950s when we had all the desks in a row.
yep.
They show that picture oftentimes when you're getting any form of educational degree or taking an educational class. So I guess one of the things is you mentioned that that can be a challenge, the challenge of the cold or the environment itself. What do you find are some of the challenges that health science educators, meaning the actual instructors themselves, are having in the classroom?
I think we educate the way we were educated. So I think because most health educators probably don't get into their careers as educators, they get into their careers as providers, right? And this is sort of how I came into it. Is like I was a paramedic, and they were like, "You should do some teaching," and then I found out I like sort of enjoyed it, and I'm like really wanted to learn more about it. I think that's especially EMS education. Most EMT and paramedic instructors, whether it's initial or continuing education, got into it because they were great providers. And so their education is not in education, it's in clinical practice. So their only experience providing education is their experience. Now, you've seen the opposite side of this, where you've got the educational theory, and I'm very interested in your opinion, but I'm sure you found that incredibly valuable in the classroom as like, no, I know the science behind learning, and how can I bring those practices into my classroom? But I think that's one of the biggest challenges with healthcare educators, is they got into it as providers and became educators, and just never, they have the knowledge gap. They never got the education on how we deliver great education.
That's kind of interesting. You know, in order to be motivated in the classroom, you've got to find your own jewel, you know what I'm saying? Your own piece, your own gem. So what else beyond just being a paramedic? Because being a paramedic is huge. You've done a lot. Um, what motivated you just to pursue that career collectively?
I don't know. I thought when I was going to college, I was going to go to medical school and be a doctor, and I thought that was like the end all be all. And I think oftentimes in like middle school and high school, we don't understand all of the different career fields that are, despite the number of tests we take that tell us what career we're supposed to be in, right? I don't think we quite realize that. So when I was in college, I worked as an EMT in essence, it was a patient care tech, but I was an EMT in the emergency department, and I had a blast. We were the highest level trauma center in the area we were in, so we got the sickest patients in essence. And honestly, it was just a blast. And I was like, I'm having way more fun doing this and playing in the back of an ambulance than I was like going to school. So
Yeah.
in between applying to medical school and graduating, I went to paramedic school and fell in love with it and was like, this is the coolest thing ever. I'm going to do this for a while, and then I'll become a doctor. And actually, like, I just never decided to go back. And actually, the reason for that is because I was having so much fun, and I had a full-time
Mm.
job. I was a firefighter. I was a paramedic. It was great. I was getting to help people in my community. I worked with a great group of guys. We had a lot of fun along the way. And then one of my mentors was like, you should try doing some education, just doing like some BLS instruction, some ACLS, some PALS, teaching an EMT class. And that really sparked my interest in education. And I saw it very similar. And I'm hopeful that other healthcare educators see it the same way. It's like, I can make a difference in the back of the ambulance for one patient on each call. But if I'm educating students in really high quality clinical
Mm.
practice, I can make a difference so much greater. It's one of the reasons I love initial education. It's because I don't have to break anyone's bad habits that they've developed over their careers. I can just set you with a really solid foundation, and I can teach you what to look for in the future and what to respect out of good clinical practice. But so that got me into it, and then I just sort of fell into some new jobs that were primarily teaching rather than clinical practice. And now I don't like. I love working in the back of the ambulance. It's a great place to be. I just find that I'm having a similar passion for helping people in the classroom as I do
Wow.
when I'm in the back of an ambulance.
Oh, that's exciting. So the reason I brought that up, because I think you kind of shy away sometimes about your field as also being a firefighter as well, having that background. There are several people who are going to be watching this, and this is going to be very inspiring for other people who want to learn more about the EMS world itself. What advice would you have for individuals who would aspire to enter in to either the profession of EMS education or even just becoming in EMS or become a firefighter collectively?
I think those that are looking to get into EMS in general, is that you have to get into it. Sort of the two things I think you should want to do. You should want to help people, and I think we all sort of aspire from that. And the pandemic probably really demonstrated to us the true heroes in the world are in healthcare. Because when really push comes to shove, who do we rely on? It's the people in the hospitals and the ambulances. So you have to be passionate about helping people, but you also have to have a passion to be a lifelong learner. I think sometimes we overlook that in EMS and the fire service too. It's incredibly science based. And one of the reasons I like the fire service so much is because there's so much science to fire behavior that we don't
Mhm.
always think of. People in nursing school and respiratory therapy school and PA school and medical school, it's lifelong learning. It's your oh, this healthcare is ever changing. It's constant updates. It's half of what you know today will not be the case in 10 years. But then when we get to EMS, it's like this is what it has to be, and we are doing it this way because we've always done it. And you're like, that's not what the rest of healthcare thinks. The rest of healthcare
Mhm.
knows that you have to be a lifelong learner and puts value on continued competency. And so in EMS, we're getting there. We're looking at those models, and those things are ever evolving. And I think most of our students coming into it today have a degree of science background. Those are my two things. If you're looking at getting into healthcare education, I would say the value here to make a difference in the community is huge. And we look at this all the time. I think the value in helping an individual person in the back of the ambulance, great. You're providing some life-saving benefits. I see that benefit even greater in the classroom, and that I can take someone and we specifically want people who want to help their communities. That oftentimes means that we're looking for people from all communities, right? We know that as a patient, you want someone, or you feel more confident in a provider, a doctor, a nurse that has similar lived experiences as you. That means I need people of all lived experiences in my EMT classroom. We
Mhm.
know that there's a lack of that in healthcare education right now. We lack the diversity that we need to fully serve all of our communities. That means I need to go to different communities and look for people that want to serve their community, want to be in healthcare. What I also recognize is that means I'm going to find some people who have some different lived experiences as me, and I have an opportunity to help raise those people up into this
Mhm.
field, especially fields we haven't had. And so I can take someone who's maybe in a lower socioeconomic bracket. If I can get them a training as an EMT, it's one of the fastest ways to get a job in healthcare. That and phlebotomy, literally like a month or 2 months, you can take the course and be in it. I can take someone who's maybe didn't have any thought that they were ever going to have a salaried job. They were going to work hourly for whatever they were doing. I can give them the benefit of helping their community, but also I can really raise them out of poverty as well. If that's an up, if that's the, if that's an up, if that's where they're living, we can say, great, come help your community, but also we can raise you up in socioeconomic status as well. And I recognize there's a lot of other barriers that in education we have to overcome. But to me, that's one of the greatest ones is I can find people who want to help their community. I can help their community by finding people with similar lived experiences, and I can raise them up at the same time. Not only do they get some financial benefit and get paid, and we can raise them up that way, but we're also building steam, right? We're saying you're helping your community, you're giving back to your community. I think that's if I'm a healthcare educator and I'm thinking about getting into healthcare education, those are the people I'm looking for that want to come play in our band of healthcare education.
Oh, I love it. I really do love it. Um, One of the things that I think a lot of us did when we did attend the ESO, several of us did look at the disparities.
the
Mhm.
health disparities that were there, trying to make sure that we're meeting the needs of the community.
Yep.
I do want to state that I did find an abstract, facilities, finances, resource deficiencies in accredited paramedic programs. You did have that, and the background was in reference to paramedic education, sufficient rigor and appropriate resources to prepare graduates to provide life-saving pre-hospital care. The objective was to evaluate the programs, the resource deficiencies in the U.S., and identify common deficiencies that may impact program success. The reason I bring it up is because I want others to know that you do have an abstract that's out there. It's from 2022, but it is really interesting to read, and I really wanted to bring that up. You have several other resources that are out there that you have published as well, that are accessible to others who may want to learn more about who you are and what you do. I just want to say, Michael, this has been a complete pleasure. I have learned a lot about who you are, even more than I did before. Um, and I'm sincerely hoping that others who have questions in regards to health education can glean light to what actually you have discussed. You have discussed such a wide array of things for people, talking about the classroom and how the classroom has changed, especially during COVID, after COVID. You've talked about the learning styles, reaching the community. You have done such a lot in this particular setting for us today that I just want to say thank you, because I want to make sure that we reach others. What is one last thing? If you could tell anybody one last thing about health care or health science, what is one thing that you would like to put as an impact?
Question. Well, first, I appreciate the opportunity to be here and join you, and I'm your biggest fan. So if there's anything I can do to
Oh,
help in the
thank
future,
you.
I'm quietly in California cheering you on. I
Thank
think
you.
yeah, absolutely. I think one of the big things that my takeaway and what I've seen and what I've experienced, and hopefully what I can reciprocate to the educators in EMS is it's a team sport. We're all in this together. What I'm teaching in my EMT classroom is likely the same as what you're teaching in your EMT classroom. If we're not seeing successful results, which by the way, we need, right? We need more healthcare providers, nurses, doctors, EMTs, paramedics across the board. We need more of them. That means we need continued success in all of our classrooms. If there's something we can do together to work on, to look at, to say, gosh, how are you testing? How are you marketing? How are you administering? How are you educating? What we can do together makes us all stronger. There's some things we're doing really, really well. There's some things we have to work on. And I didn't invent the wheel, but I'm certainly taking advantage of those who came before me who did. If there's something we're doing that we can work together on, that we can help, we were really proud during COVID. We put up a website with resources on different things we were doing to help educators out there that were like, we have to switch to a hybrid model overnight. Right. We took years to get all the right, tools enough. So it's a team sport and we're in this forever. If there's anything I can do to help, that's what we want. We're all here for the exact same reasons. It's to get more people out and to serve their communities. If there's something we can do together, let's do it together. And then again, just thank you for the opportunity.
This has been a pleasure. Thank you so much. As always, we will remain in contact. I thank everyone who has tuned in to Cold Press Conversations on this particular session with Michael Kaduce. I want to say thank you once again. Please look forward to next month. We do have another guest who will be arriving on the screen as well. May each and every one of you please have a wonderful, wonderful day. Take care.
I hope you enjoyed this episode of Cold Press Conversations. If you love this episode as much as I did, I need you to head on over and subscribe so you never miss an episode. This is Dr. Jewel signing off to health and cognitive happiness.